Welcome to the second day of the conference of the project Regions for Permit project. Today, as I mentioned yesterday, we are going to focus on public procurement of innovation. This is the last session that we have in the conference titled Innovation Flow into the Healthcare. And first of all, today I would like to start with a short movie presentation of the project where we can see the partners of the project and the consortium. So let's start with the video.
Regions for PerMed is an international project establishing a permanent dialogue between 5 European regions to support implementation of best practices in personalized healthcare.
Personalized medicine holds great potential for science, healthcare, and industry. European regions, on the other side, have great power in terms of investment and policy. With the European project Regions for PerMed, we want to understand the role that European regions can play in the implementation of personalized medicine. With this action, we are analyzing these aspects, and we will be providing national and regional government with guidelines and best practices on how to engage European regions and how to commit them to a great role in this important subject.
Samorząd Województwa Dolnośląskiego zaangażował się w projekt, którego celem jest popularyzacja medycyny spersonalizowanej. Jest to zgodne z strategią innowacji Dolnego Śląska, ale to również doskonała okazja do zacieśnienia relacji międzynarodowych, porównywania rozwiązań, które funkcjonują w różnych krajach europejskich.
The Saxon State Ministry for Science, Culture and Tourism joined Regions for PerMed in 2018. We decided to do so because Saxony has both a strong need for personalized medicine due to its rather old population and outstanding competencies in medical research and development. Our topic is personalizing health industry. We have organized an online expert conference to this topic in October 2020. And we will organize another series of webinars addressing regional stakeholders in spring 21. We are looking forward to see you there.
Welcome everybody. I'm José María Romero, Director of Health Development and Innovation at the Galician Health Knowledge Agency, ACIS. Through dedicated teams, ACIS works closely with the Regional Health Ministry and the Galician Health Service Sergas towards the goal of providing sustainable healthcare service with the highest levels of quality for patients. Sergas aims to tackle the shift from a reactive healthcare system to a preventive and predictive system and shares with our partners the goal to set up the first interregional cooperation on personalized medicine. The conference and the workshop organized by ACIS will invite leading organizations and experts with experience in the adoption of personalized medicine technologies organized around sub-areas such as smart and future hospitals and innovative procurement tools. See you soon.
Good morning. My name is Paola Bella and I represent Lombardy Foundation for Biomedical Research. We joined the Regions for PerMed project as we strongly believe in the role that regions can play in the implementation of personalized medicine. In our work package, we organized a workshop and a conference on the topic of big data, electronic medical records, and health governance. We are looking forward to working with all the Regions for PerMed partners.
Wrocław Medical University is the only academic partner in the consortium. We continue our tradition of engaging in every community-based project which can improve well-being of our patients. The Conference on Health Technology organized in 2020 summarized new promising solutions which have been implemented.
thank you to all the partners of the consortium. Before starting the session, I would like to give the floor to welcome words to Gianni D'Enrico, that he's the coordinator of the Regions for Permit project from the Toscana. Good morning, Gianni.
Hi, Jose. If you stop sharing your screen, I can share mine.
Yes, we will share. We will stop to share the screen. Yeah, I think you can now.
You see it?
No, you have to put full screen.
Yeah, wait, just a second then. See now?
Yes.
Okay,
now perfect.
Okay, good morning, everyone, and welcome to this second day of the conference of the fourth pillar of Regions for PreMed. I gave you this brief presentation yesterday. Since today we have new participants, other participants, I'm going to briefly explain the reasons and the main goals of Regions for PreMed. As you know, why regions, first of all? Regions, local and regional communities in Europe have a great role in delivering the benefits of the digital transformation to the public. They are responsible for 50% of public investment in Europe. They receive and reinvest 25% of tax revenues, and they are the major public employer. These numbers gave us the idea that regions are an important player to involve if we want to talk about personalized medicine. The idea of Regions for PreMed was born like 3 years ago, more than 3 years ago, when we realized that in the all European fora, scientific policy fora, where they were discussing how to bring personalized medicine to patients, regions were never involved. So, and since in many countries, regions are responsible for the healthcare organization, and in almost all the countries they have investment, they do invest in research and innovation, they do invest in healthcare modernization and digitalization. We realized that it was time to involve regions, and we devised this European project, Regions for PreMed. The Regions for PreMed is a piece in the puzzle of the European Commission on personalized medicine. It is the European pathway started with the International Consortium on Personalized Medicine, ICPermed. Then it was time for the funding schemes, which is ERA-PerMed, the European research area for personalized medicine, and we are in this path. Regions for Med is in this path with the European Commission, with other international projects like SINO-EU-PreMed, and strategically. Also is synergic with the European Genome Declaration, with the smart specialization platforms for industrial modernization, and so on and so forth. This is the so-called ICPermed family. Those are all the European projects which at a certain level are playing a role in for the implementation of personalized medicine. And you can see we have different international projects. We have health economics, we have clinical trials, and we also have the Regions for PreMed, which is more on the regional policies. The Regions for PreMed is built already on solid ground because, as we can see, health research and innovation is already a priority for many regions in Europe. They understand the value of research and innovation, and they are investing on it. But when we go to the personalized medicine, we see that the strategic importance of Regions for PreMed is more faded. And reading the policies on personalized medicine, we realize
realized that there wasn't an alignment. The personalized medicine was contemplated and implemented at a really different way. So with this in mind, we set our goals. What we want to do with our project is actually to coordinate the European policies, the European regional policies and innovation programs on personalized medicine. We want to reinforce the industrial specialization areas in Europe and make personalized medicine to flourish as an emerging industry, because the potential is really huge even there. Enable interregional joint investment on this topic and provide the European Commission, the member states and other regions guidelines on how to how to invest on personalized medicine. The specific objectives of our project is to organize a technical dialogue between experts and policymakers on 5 key strategic areas. We want to provide at the end an action plan for the strategic areas of investment in personalized medicine. We have already established a European hub of initiatives and partnerships on personalized medicine. We are actively involved in the next European partnership on personalized medicine as well. And we will, at the end of each key strategic area, we release a report with the guidelines and best practices for member states and regional authorities. These are the main pillars. The 5 key strategic pillars is big data and health, electronic health records and health governance. We had health technology and integrated care. Then we went through the personalized health industry, how to improve the research and innovation in the industry, how regions can improve the delivery of health innovation from industries. And now we are tackling the innovation in healthcare. The last pillar will tackle social and health economics aspects. The work methodology is we prepare a scientific rationale that we will also share with our advisory board. Then we plan a conference, which is a technical conference where we invite the experts to talk about the main challenges and provide some ideas of how these challenges can be tackled. Then we have organized a workshop with policymakers where we discuss how these challenges can be tackled also by the regional authorities, what the regions can do to improve these aspects. Then we integrate this information with surveys, with in-situ visits, and then we deliver the report with the policy recommendation, investment recommendation, and a list of best practices. So each pillar is organized with the conference that we are having today, a workshop with the policymakers, capacity building and co-creation meetings, and in-situ visit. These are like the 4 areas of, the 4 methodological steps of our project. We started with the big kickoff conference, which took place in Milan in 2018, at the end of 2018, within the European Congress on Personalized Medicine, where we had over 500 participants, 30 countries, and the main European institution joined us, like European Commission, European Investment Funds, and European Investment Bank. These are the past events in a nutshell. This is what we had for the first pillar, and we released already last year a report with the guidelines. Then we had the health technology and connected and integrated care, and the report is about to be published. We expect to publish it in September. The personalizing health industry is also working on the report, and we believe that by the end of this year, we will be able to publish it. This is the community of regions that have already joined us, the so-called interregional committee, with which we cooperate, we dialogue, and we receive inputs to improve the outcome of this project. We are also planning a big event at the European Parliament for December 1st, 2021. We have invited members of the European Parliament, members of the European Committee of Regions, European Commission, and the overall goal is to promote, to push other regions to join the project, to be committed on personalized medicine, but also invest in these aspects through the European Partnership on Personalized Medicine. Also, make sure that all the outcomes of the project are scientifically sound. So we publish, we are trying to publish as much as possible. These are the main publications related to, to our project. And last but not least, this is our advisory board with which we cooperate. We receive inputs and we fine-tune all the deliverables of the project, and to whom I would like to say a big thank you for all their support. That's it. This is the team. I'm really looking forward for today's discussion. I'm here and I will be interacting with all the speakers. Thank you very much.
Thank you very much, Yanni, for the presentation of the project, and well, I think all the participants have an overview of the projects, of the work done, and the work that we will do in the near future. Before going to the first speaker, I'm going to give the floor to Anna, that she will well, explain the system, how to ask questions and how to vote in the polls.
Thank you, Jose. If you have any question or comment, please send to us via Slido. The link is on YouTube channel, and when you enter with this link, you will find a Q&A session and also the polling questions. We will be very grateful if you will answer these questions, and thank you very much, Jose.
Yeah. Thank you, Anna. Well, we will start with the first speaker. As I mentioned yesterday, today it will be a monothematic session about public procurement of innovation tools. And, well, unfortunately, our first speaker, Ramon Maspons, due to, well, the COVID situation, cannot join us today. But we have Rosanna Alessandrello, that she is a value-based procurement director in the innovation unit at Aquas. Aquas is a public entity linked to the Department of Health of the Government of Catalonia with the mission of promoting the evaluation of technologies and health services, the analysis of the social impact of research, big data, innovation, and public procurement in the participation of citizens and professionals. She will start, well, with the first part of the of the agenda with title Why PPI Benefits of the Public Procurement of Innovation. Thank you, Rosanna.
Thank you.
The floor is yours.
Thank you. Thank you very much. Just because to understand better, I have almost 15 minutes for this presentation. How long?
Yes,
yes.
As you need.
Okay,
yeah,
okay, good.
There is no
Thank
problem.
you very much. Okay, thank you. So I share my screen. Okay, and you should see now my presentation. That is the presentation that should be.
Yeah.
Okay. From Ramon Maspons. Good.
Yes.
Okay, so sorry if I will be the one, maybe not so inspiring as Ramon is. If any of you knows Ramon, how he's a very good speaker, an inspirational one. But by the way, let's see, I will try to do my best. Okay, so thank you very much for the organizer to inviting me. I think that this is very nice opportunity because also thanks also to the, not only for the organization, the organizing team, but also for the coordinator to explain better, no, why we are talking about innovation today, and how this is a key pillar, no, innovation procurement, also in the investment for personalized medicine. And in fact, I will also give some example regarding this, and so hopefully later in my next session. So hopefully this is something that also will bring some more elements on the table for this very interesting project. So why PPI? Why we are talking about public procurement of innovation, and what are the benefits regarding PPI? I think that it's very interesting to start talking about very take-home messages regarding this session. Because there are some key elements that always we need to think about when we think about public procurement of innovation. And there is no static need, and there is no static solution. Everything is a fruit of a dialectic between the demand and the market. It is clear that the needs need to be defined by the demand. In the public, we need any smart investment start from a clear definition of what is need, what are our needs, what is needed, what do we need. If this is not clear, there are always bad investment. But still, these needs need to be addressed by solution. So if there are no solution, the level of ambition needs to be lowered, because no one can go to Mars by itself. So there is a need to have a technology up there, or to have a commitment of a risk and sharing and benefit sharing that allows in a given time frame, with a given resources to address these needs. So the dialectics between the needs and the solution is a very first point, very important, very relevant. Never before so much innovation at the funnel. That's true. We are now completely somehow. We don't know where to look at, because we are the innovation, all the innovative solutions that are out there are incredible for us. But are all of them really useful for us? Not. I mean, there are clearly, depending on the who is doing the demand, there are different level of how much I can absorb, I can adopt this innovation. And maybe my economic resources, the risk, financial risk that I can take is not so big. So unfortunately, at least we can say now with this COVID crisis, also maybe before COVID we were already in this situation, but clearly right now we are in this moment, the financial capacity to adopt this innovation is really poor, and so we need to find ways, to have the opportunity to grab this innovation that really is addressing my needs, with the resources that I have, in a sustainable way, in a way that then not only now, but in 5 years' time, I can still have this innovation in place, this technology that is no longer innovation, still I'm already adopting it, but in a sustainable way. And then clearly, not all the rules are not all the different buyers, the different healthcare providers can maybe have different environment that in these environments, economical, political, are somehow influencing how we can get on hold of these innovations. So we can also try to have different approach at place. What is valid now in a region from the south of Europe maybe is different from the north, or maybe is different from the east, or maybe different from the west. So, this flexibility needs to be in place. So it's not just nice to do, is need to have for this part of Europe, of the region, of the maybe also the sub-region within the region, because the environment aspects are critical. And also, so we would like also to highlight these 6 keywords. So we need to be strategic if we want to do a public procurement of innovation, because we really need, again, to know our needs, our ambition, why we want to do it, how far we can go. Clearly, if the innovation can be a key element for transforming the healthcare provision in a way that can be more sustainable, and not only more sustainable, but maybe also let's say it, that we can maybe also be stronger in front of unfortunately, another storm like COVID was in our life. So also we need to be also more resilient. Patients always in the middle. I would also change this word from this presentation and add the word citizens, because we should not only address the healthcare provision from a perspective where we know who is the patient already, but also what about prevention? So ensuring that the citizens don't one day become patients. Without analyzing what we do, we don't go anywhere. So the part of analytics is key, and in fact also it's we are really aligned now with also the exercise that you are doing in this project, because one of your key pillar, well, the first one was big data, but big data is not just is the ability then to analyze what happens and to evaluate. So the ability not only to analyze, but to evaluate the different scenarios that are in front of us, what is happening, in a way that then we can offer tools to the key decision makers to take the right decisions. And for sure, in all of this, together with all these elements, we need to talk about reimbursement. Because again, if we want to be resilient, if we want to be sustainable, we cannot go by our own without not forgetting somehow, without talking with the payer, with the insurer, with the one then will reimburse the healthcare services fruit of the innovation we adopted. Here there is a slide of the Global Competitiveness Report from 2019, and we see the first 20 regions in the rank of the region, countries more competitive worldwide. And if we look into them, we can see different things, but what we would like to highlight from these slides is what they have in common. So let's go to the next slide. There are clearly, this country have some physical forces that are making them more competitive and leader in innovation. They have a strong force in attraction. Clearly, they are countries that are able to attract talents, and not only talents, but if we look at the OEMs, the original equipment manufacturers, they also are able to attract specialized suppliers. maybe these suppliers are also coming from outside their country, but their level of specialization is strong. And also they are, thanks to this, they are attracting innovative companies. So there are somehow strengthening their gravitational force and attracting talent and specialization. Also, they are strong in information. What do we mean with this? With the information, they are able to create knowledge. And this knowledge is transmitted always in area of proximity. It's true that then you can go, as we are doing now, through seminar, global conferences. But at the end of the day, the knowledge that you generate locally and you're able to diffuse locally through the value chain of the relationship that are created locally, create the possibility of boosting the creation of new technology, new business plan, and why not new market trends. Then there is the force of the interaction. Always, this is this also was study of economies, that positive interaction raises exponentially critical mass of cluster interactions. Then there is also the force of rivalry. If we are good in something, locally, we are stimulating competition in our proximities. And this is making us geographically stronger in this competitive technology, competitive specialization, competitive talent that we are creating in our local cluster. And in the end also, this will allow us, little by little, creating all these forces, also the force of anticipations. If we are interacting in a tech-demanding society, what we are doing is that also we are already advancing what is going next. Where are our public buyers going? What are the trends? Since we are now analyzing what is happening now, we can also anticipate the needs in 5 years' time, 10 years' time, and maybe also longer, 20 years' time. All of these forces are the ones that are in common of the 20 countries that we were looking at before. And these forces are also the leading of a very good, successful strategy for a competitive innovation regions and countries. Why we are highlighting this? Because when we talk about then public procurement innovation, we need also to think about, from a public entity perspective, these forces that we were now listening. So innovation is not innovation per se. We are not just innovating because for the sake of innovating. This is completely useless. We want to innovate because we need to address some specific drivers. We need, for instance, go towards personalized medicine. We need to reinforce prevention. Citizens, not only patients. We need to have our healthcare service sustainable, not now, not in 2 years' time. When we adopt innovation, this innovation, or we adopt technology, whatever, we need to already to think about is this going to be sustainable for us in 10 years' time. We don't want to be just buy products. Again, as we were saying in the first messages, the demand and the solutions need to go together. So it's not just a product. We want services. we want to take risk and benefits together with our local industry, or with our industry in any case. Why? Because we have innovations, but unfortunately, maybe our financial risk right now is not, we are not so, no, our economic ability is not the same that it was some years ago. We want to ensure that what we do makes sense, because also for our citizens, for our patients, the outcomes are going to improve little by little. Clearly, now we are talking, we see a lot of trends in the healthcare industry, like value-based healthcare. But value-based healthcare is not something we can do from one day to the other. It's not something that we can be like we transform everything from one day to the other. It's impossible. But yes, we can little by little ensure that our investments have a direct effect on the patient outcome. And all of this clearly needs to be done thanks to the adoption of technology. And again, innovation done taking into account that we can have it, these innovation cultures that we were talking about in the slide before, together with the drivers, cannot go just without thinking about, again, the reimbursement, the payers, payment models, business models from healthcare perspective, what we call business case, fee for service, outcome-based results between the payer and the healthcare provider. So why not between the healthcare provider and the technology provider? And so the creation of maybe public-private partnership, new way to work together, new business model, new services, new metrics. Maybe we don't have the metrics right now to put all of this in place. But yes, with innovation, when we plan to have a public procurement of innovation, we can already plan to collect the data, to create the information that will allow us to analyze what we are doing, and then create the metrics, and then create this new relationship, these new evaluation approaches. So with innovation, we are not just creating new knowledge, and we are not just having new agents in the sector. Both components are clearly there, but this somehow is something already given, no? Always with innovation, you create new knowledge, and always with innovation, you are creating new agents. Maybe also new dissemination models. But now we need to go further, and we need to go to the creation of new business models in a way that the industry and the healthcare providers, so the private and the public, can go together. And this also means new tools for funding. New tools for funding the creation of this new knowledge, new tool for funding this creation of new dissemination models and new agents. New tools for funding this adoption of innovation, so not just the creation of innovation. That's the key. It's not just that we are creating innovation and that's all. We want to adopt it. So again, the sustainability along the time. Thank you. This is my first session.
Thank you, Rosanna. Well, before going to the next part about barriers to overcome in public procurement of innovation, I would like to ask you a question. Well, it's a general question about public procurement of innovation, and I wonder if you have to select one main benefit about public procurement of innovation regarding personalized medicine, which benefit would you take? Would you select?
Okay. The benefits are clear. And in fact, in my next presentation, maybe I can give a concrete example, but maybe I can anticipate it with the answering to this question. For instance, we are now in a project that is a pre-commercial procurement. Pre-commercial procurement is a tool to procure research and development services, okay? So something that still does not exist really. So we are sharing risk and benefits with the industry from the public health players to ensure that something that does not exist will exist. And we are doing it exactly in NGS solutions. So what more than personalized medicine NGS? And this is called, I'm going to mention this right now, ONC NGS, pre-commercial procurement. And this is a way to push, to boost the industry to deliver new technologies related with NGS to really address the public needs, and not to somehow go towards a technology push. Then the public adopters need to go behind, but they are not really saying, look, no, sit down and let's see what are really our needs. And because we need to be sustainable along the time, and this is not the way we can go.
Thank you, Rosanna. So, well, now we will go to the next presentation, that it will be the main barriers to overcome in public procurement of innovation and PCP projects.
Yes, thank you. So I will share again. 1 second that I'm open before the presentation. So I'm ready to go. Okay. 1 second. Okay. Okay, when
full
in this
screen,
case,
please.
Yes. 1 second that I cannot find now. I don't know why. Okay.
No, I think it's.
I cannot find the scene here.
Presentación de diapositivas, I think. There.
Presentación,
Yes.
okay.
Yeah.
Thank you. That's the principle. Okay, good, thank you. Okay, so in this case, I'm going to start why we are, well, probably you invited us, because, so that's also is something, because this presentation is a fruit of several experiences that we are running from 2012. We have had several projects funded by Framework Program 7. The first one was the CIPHER pre-commercial procurement, that has been the very first pre-commercial procurement in mobile health, and we coordinated it starting in 2012, and in different areas, services and preventions, devices, implants and prosthetic, pharmacogenomics and genetics. And then also we had several, so these are experience more in really public procurement of innovation or pre-commercial procurement. And then we had also several experience in creating coordinated support actions, so in creating community of practice like ORIF and PIPI, or more in boosting the knowledge related with public procurement of innovation, like Inspire, and now education program like UpRaise, that was last year, and this year iRaise. And then also we have the experience of since we are an agency of the Department of Health of Catalonia, the Department of Health of Catalonia wished to boost the adoption of these instruments through the healthcare system, through the ERDF funds, and put 30 million at disposal of their healthcare provider in a way that then we had a competitive call. The healthcare provider submitted more than 30 projects. 18 of them were awarded, and now they are running this 18 procurement. All of them are public procurement of innovation, none is pre-commercial procurement. And now we are seeing already some results in progress, so we are really satisfied with this call. That was the first one. And so clearly also there are a lot of lessons learned regarding this. And so as you already saw, well, first of all, regarding barriers, instead of barriers clearly is a word that have a lot of meanings, and is a word that is always, you can see the barrier is a barrier, a main barrier, but then also is a neighbor. So I address this presentation with the idea that every time we have a barrier, we can address this barrier with a question. Why? Because the questions are the questions support us to give an answer, and then to put the resources in place to overcome the barrier. The first barrier that we have when we talk about public implementation is what procedure we are talking about. And that is key, because we have three really procedure in place, procurement procedure. Maybe we have also more, in fact, but the main ones, I would say there are three. And a lot of times people, they don't know really what we are talking about. The first procedure we're talking about is, I would say, I hope you see my mouse, pre-commercial procurement. The pre-commercial procurement is, as I was mentioning before, a procurement where you are procuring research and development services. And to procure research and development services, you are doing it in a way that it's key. So you're ensuring that these are research and development. So there is no solution in place that is addressing your needs. So your needs are unmet. And so you need to be clear in the state of the art. The state of the art needs to tell you there is no solution in place. And the market also needs to confirm that there is no solution in place. You are also sharing risk and benefit with the market, because the R&D is already intrinsically a risk procedure. Maybe at the end of the day, you are not really reaching the results that you want to achieve, but also you are doing it in a way that then the industry, differently from a normal public procurement, is going to retain the IPR. This means that the industry, if it's going to retain the IPR, is going to share with you also the financial risk to make this research and development. And why we are boosting this, that they are retaining the IPR? Because we want to ensure that then the industry is going to exploit these results. If we are leaving them without this power on the IPRs, at the end, maybe then they are not so interested to maintain the IPR. Maybe they are not so interested to exploit them. And so we are losing opportunity, because at the end, we did all this effort, but no one is going to really exploit them. And then with this, we can be exempted by the normal, by the Public Procurement Directive, and by exempted to follow the WTO agreements. What do we mean with this? We mean that we can shape this procurement procedure in a competitive way, phase by phase. So we can then, for instance, have a first phase where the awardees are going to design their solution, and from there we are going to select the best ones, and we are going to invite them to present an offer to create the prototypes. And from there, we can select the best ones and inviting them to submit an offer to have a proof of concept of their prototypes. In this way, we are de-risking little by little, no? Also this risk, inherent risk of the research and development, because together we are assessing how far we are going, and we are not selecting from the very beginning someone that then cannot reach at the end maybe the phase of the proof of concept of the prototypes. After this pre-commercial procurement, if everything goes well, and if we are happy, and if we see that everything is working as we were as our desire, we can launch then the public procurement of innovation. That will be a normal public procurement that will follow the public procurement directive, open to everybody, but clearly based on the experience of the PCP. So the requirements that were defined in the PCP that were more performance requirements, functional requirements, not at all technological requirements. We just need to define our needs, why we want to address these needs, and how we can address the needs. This can be clearly replicated in the PPI. And in the case, in this case, again, we are de-risking the investment in the PPI from the PCP, and the best bidder that will make the best offer, also from technological perspective, to address our needs, will be the one then at the end will be awarded with a contract. In this case, it's important, if we want to follow this process, that in the PCP already, not only we define our needs, but again, as I was somehow presenting in the previous presentation, we are also somehow sharing the vision of the long-term vision, how far we want to go, what is our ambition, why we want to address this now, and what is going to be the effect, the impact of this innovation in our health system in 5 years' time or in 10 years' time. Because in this way, the economic operators that enter in the PCP are already aware how far we want to go with the PPI. And already they can also somehow design the solution with this vision in mind, and also their business with this vision in mind. That's key, because in this way, this is something that maybe the sophistication of technology, depending on our ambition, of the buyer's ambition, maybe is not, maybe yes, needs to be sophisticated, but maybe not too much, because maybe it's going to be too expensive, and maybe it's not going to be sustainable for the buyer. So all of this needs to be already figured out during the PCP, when we launch the PCP. Then we have the innovation partnership. The innovation partnership is a new instrument that has been designed with the new public procurement directive, where somehow they put together the PCP and PPI in one procedure. So when you launch the PCP, you already at the end of the PCP are able then to, after the PCP, after the proof of concept, move on with the phase 4, and the phase 4 is already the deployment of the solution, of the successful solution coming out from phase 3. So it's all together, it's one procedure. While in this PCP, pre-commercial procurement is followed by the PPI. There are two procurement procedures. Innovation partnership is one procedure. And in the normal public procurement, what we have is, again, it can be a PPI, so that we are going to launch this public procurement of innovation because we have prototypes that are not yet commercialized products that through the PPI we enable that the vendors can somehow streamline the production, and so start going from prototype to commercialized services, or is maybe different use of maybe you are introducing innovation in a different way, that maybe also mature products that we are going to use them in an innovative way, or maybe are also innovative off-the-shelf products, but the contracts, the basics of the contracts are completely different, because we are going through from the supply contracts to the servitization of the service. So somehow we are completely changing the way that we procure these off-the-shelf products. And this is one of the examples we have is in Catalonia, and also at European level, we did this exercise procuring in a different way the dies or the pacemakers. Another question that we should address to overcome our barriers is, what are we clear? No, sorry. Now I see there is a misspell. No, is it clear what is going to be addressed and why? This is key, because again, in this image there are different elements, and sometimes when we talk about innovation, we just focus in this first block. This is normal a lot of times. Now, several times we do R&D agreements, or maybe we do clinical investigations, maybe we do an European project. So we have an individual healthcare provider, maybe not individual, maybe there are healthcare providers from several regions of Europe that are addressing with the industry a specific issue, and they are enabling, thanks to these projects, that the technology go from maturity level very low, maybe TRL2, maybe thanks to these projects, also we reach a more mature level. More mature level means that maybe also we can reach the CE mark. So we are a medical device. And these are very good projects, fantastic. But if we are looking into it, maybe we are losing all these aspects, what we are addressing from the healthcare system perspective, from the payer or the health insurance perspective, the reimbursement, the coverage, and how then this can be adopted through a public procurement. So several times, if we just look this part of the figure, this part of the picture, we are not looking at the full perspective. And so when we are going to really, one of the main, I would say, barrier to overcome is that in this kind of project, we look already to the big picture. And if we look already to the big picture, we can already see elements on how we can, for instance, enable this public procurement in a way then these R&D projects is not somehow already creating some situations, then the public procurement cannot be done. For instance, if I am a healthcare provider and I join this project and I own the technology, I own it, then at the end, to deploy it in my own site, I cannot procure it because it's mine. So if it's mine, I can reach agreements on how it can be maintained. But then, so the health system will have maybe problems if I own it. So there are several aspects that needs to be really taken into account several times to ensure that then this step can be done. And other aspects that are key, so it's not just the part of the ownership, but also is the part of the reimbursement. How, if I adopt this innovation with the public procurement, so already this step is clear to me, so I will do it, already this is already in the plan. But I forgot to talk about with the payer in the impact that this technology will have in my health care provision. If in my healthcare provision, I need to take into consideration then this, for instance, I'm paid for physical visits, but now I'm going to online visits. So if this model is changed in the reimbursement needs to be adapted, I already need to think about it when I start this collaboration. And the healthcare payer most probably then will come up to you saying, okay, I will reimburse it in a different way, but then you need to tell me what I do again with this. What is the cost utility? What is the cost effectiveness? Well, let's see, there are maybe several aspects that we'll need to look into it. So all of this needs to be addressed. The level of ambition, it will be just for me, it will be for the health system, needs to be really taken into account. Another question is if I know how far my needs are unmet and how far the market is mature to address these needs. I already mentioned this during my previous slides, so I'm not going to repeat myself, but that's important. So once I know that what are my needs, I need to verify if my needs are just for me or are needs that also other healthcare provider share with me, because if it's just me, it's just to adopt the solution or the processes that other healthcare providers have in place. I don't need to invent anything, really. But if my needs are really unmet, so I verify that are really unmet, I really need to look into the feasibility analysis, so the ambition and the concept viability, the ambition to address them is something that I can take the risk. Is a risk that I can take it. I can take it by my own. I can take it with someone else, because by my own I can't. So maybe a pool of buyers enable me to get access to an innovation that by my own I can. And then I need to check the market, how far they are. If they are mature enough to provide me a solution in the time frame that I expect, because maybe they can't. I want this addressed in 5 years' time, and they are so far that they can address it in 15. So does it make sense? Maybe I need to reduce my ambition. So again, how much risk I can take? Can I take? And so the problem definition is known. I really need to define my needs. And this is me, is the demand. The demand needs to know what they need. But I need to understand if the solution, it does not exist yet, or exists but cannot be deployed yet. And depending on the risk that I can take, my influence on the market, my purchasing power, I can go from maybe an international PCP programs funded, why not, by the European Commission, the basic grants. These are really useful instruments to start with, or maybe I can take the risk by my own, so I can already launch my PPI. And the final question that I would like to put on the table is are the skills. Do I have the right team or to take into consideration this kind of procedures. The right team means that they are appropriately skilled, and this is one of the projects education program we are involved, because this is key now. Not only the cross-border collaboration and the cross-border learning we take through the different projects, through the different experiences, through the different also community of practices, but also now we need to make sure that we have maybe a formal way, to get these skills on board, because at the end, these kind of instruments are really useful again in this moment, to get the innovation that addresses the needs really we have, with the ambition we have, and maybe also to dialogue with the industry in a way that then they see the model, they see the business, also sharing the risk and the benefit with us. And so we put together this education program. That is now recruiting a team. So I also, the application is open. I also make some advertisement now here. But by the way, where we are, we're putting emphasis in the skills during this education program that we have now in color. We need to know how to work in teams. We need to have teamwork and leadership. This is key. Multidisciplinary teams are key behind this kind of procurement. We need also to have a strong strong skill in analyzing, problem solving, a strong application, practical thinking, because again, we need to think about what is going to happen if then this future happens, is real, and we can this innovation can be really then one day adopted by our healthcare providers. And design and project innovation creativity, also thinking out of the box. If we don't have this somehow imagination, what if, it would have been great if, what happens if we go to the moon, we don't get this right ambition in place, and maybe we miss some important steps for the overall process. That's all. Thank you.
Thank you, Rosanna. Well, sometimes I guess, when we think about barriers about PCP and PPI projects, the first maybe barrier that we think is always about lack of funding. But taking the part of the last part of the presentation, about how to the skills, and also about the culture of the public procurement innovation project to spread in all the organizations, I think it's also key, an element, to involve different departments, different areas, because public procurement of innovation projects is not only, of course, is the part of the area of the procurement, but also the finance area and so on. Mm-hmm.
Yes, the public, okay, in our Aquas, in our experience, we always start this kind of project because we have some healthcare professional there are some of them that are more prone to change things, to imagine that they want to go to the moon, that they knock the door for Ramon or mine, it depends, sometimes in mine or sometimes from Ramon, and they say, I have this challenge and I really don't know what to do. I'm desperate. To me, every day it happens this. I have this bottleneck, I have this inefficiency, and this cannot happen. I cannot continue in this way. What can I do? And so when this happens, we start to work with multidisciplinary teams. So healthcare professionals clearly are key. Usually they are the ones coming to our, knocking our doors. And they can be physicians, they can be nurses, healthcare professionals. And then we start to put together a team of professionals from the healthcare organizations. So not just healthcare professional. Maybe we have someone from the maintenance team, someone from the ACT. The procurement will come later, because first we need to elaborate more what is the need. Because from the challenge to the need, there is a step. The challenge is not the real need. So we need to identify from the real from what they are saying, what was the real need. And from there, if we see that it can be, in our case, usually we start thinking about if it can be systemic, if it's something that does not happen just in this healthcare provider setting, if it can be something that can apply with the view of the payer, because we are an agency of the healthcare department. So with this view, so yes, we can start to involve also maybe someone from innovation. Really, we are the ones that we play this role, but clearly we are happy there is an innovation member from the hospital. Maybe they have it, not always, but sometimes they have it. Then the procurement unit, and the procurement unit is really is a service like the innovation unit to make this happen. But the challenge is key.
Thank you, Rosanna. I kindly invite you to wait until the end of the session, when we will have questions from the audience through Slido. And now I'm going to give the floor to Ana Lucia Jaramillo. She is legal procurement researcher from Covers Procurement Services, which is the main contractor for the European Assistance for Innovation Procurement, EAFIP initiative. The European Assistance for Innovation Procurement Initiative is an initiative from the European Commission, DG Connect, that aims to provide promotion, training and local assistance to cover procurers and policymakers that are interested to implement innovation procurement of ICT-based solutions across the EU member states. Ana Lucia will present their experience in the implementation of pre-commercial procurement and public procurement of innovation projects. Thanks, Ana Lucia. The floor is yours.
Thank you. Good morning with everybody. I will share my screen now. So this, that's it.
Yeah, full screen, please.
Yes. Yeah, can you see my screen correctly?
Yes, perfect.
Okay, so thank you again, and my name is Ana Lucia Jaramillo. Today I'm going to talk about the PCP and PPI approaches and the European Assistance for Innovation Procurement, focusing on the EAFIP methodology. I would like just to present the Corvers team. I'm very proud to be part of this team. We'll also invite you to look into the publications of the Chair on Innovation Procurement, the Corvers Chair on Innovation Procurement at the University of Zaragoza. We have some interesting publications. And today I would like to have a short introduction to the European Assistance for Innovation Procurement, then focus on the EAFIP methodology, the outcomes and questions that you may have. So welcome on board. As you have mentioned before, the European Assistance for Innovation Procurement is an initiative of the European Commission of DG Connect, and it started in 2015. Corvus was a consortium partner from 2015 until 2018. And since 2019, Corvus is a contractor for the EAFIP. So the EAFIP offers you different tools, different resources. I invite you to look into the website. We have a toolbox for policymakers, procurers, and legal advisors. There's a toolkit that has 3 modules, and it addresses the step-by-step methodology, providing guidance and techniques in each of the steps. The first module is designed for policymakers, the second one for the procurers, and the third module for legal advisors. It provides examples, case law, etc. We also provide different webinars, conferences, and workshops. You can come into the website and also look into the coming workshops. I invite you to register for the workshop on the 22nd of July on the management perspective on the benefits of innovation procurement with top managers from Belgium, Greece, and Spain. So please register. And also we have for you some videos on the testimonies of public procurers and suppliers who have implemented innovation procurement themselves. So please, if you're interested in more about innovation procurement, you can look into these examples and get inspired by them. So now, what is innovation procurement? Well, Alexandra has already tackled many of the aspects of innovation procurement, but just let's complement her presentation. So innovation procurement happens when public buyers acquire the development or the deployment of pioneer innovative solutions to address specific mid to long-term public sector needs. And here you see this flowchart that shows the whole cycle of innovation from the curiosity-driven research until the actual deployment of the solutions. So when we see pre-commercial procurement, we see this phase of R&D that covers the solution design, the prototype development, and the testing of a limited volume of products or services. And here we see that we have this phase approach, competitive phase approach, where we have different suppliers that at the end of a phase are evaluated, and the solutions, the ones that are successful, come to the next phase. So when the pre-commercial procurement is completed for the procurement of the actual solutions, there is a need for the launching a procurement itself. So thinking about this taxonomy of innovation procurement of PCP and PPI, we will show you how the step-by-step EAFIP methodology takes place. So here we see 5 main steps that we have called this the business case methodology, and these are 5 important preparatory steps. So before you actually launch a procurement, it is fundamental to have performed these 5 steps. So the first one, and we've seen also examples, very interesting examples from the previous presentation of Alexandra, the needs identification and assessment is fundamental. So we need to know what the problems are, what the specific requests from the end users are. And for this, we have different techniques to address these issues. So when the need is defined and scoped, we can look into what is out there. So we conduct a prior art analysis and an IPR search to know what are the solutions available, whether these solutions can meet the requirements of our needs. With this prior art analysis, we also do an analysis of the standards landscape to see what is the degree of consensus on these solutions that are available. And based on these needs analysis and keywords that we have established. With the results that we have after performing this desk research on the landscapes and the IPR, and of course, understanding what the needs are, we conduct a market consultation. We're going to challenge the findings that we have with the market. We will inform the market and see what the market can offer. With this information, we can do our value calculations. We can start to build up our business case and decide on which trajectory to take. So let's go into these steps in detail. So step 1, the needs identification and assessment. So every innovation procurement starts with an unmet need. So this is a requirement, or is a set of requirements that public procurers have now, but even better, that public procurers will have in the future. So for them to be prepared, because these current products, services, or arrangements cannot meet, or can only do so at an excessive cost or without an acceptable risk. It is very important to start the needs identification and assessment at an early stage. And this can be done through different ways of working inside the organization with periodical meetings, with understanding what the users require, what the challenges are. And in doing this early assessment of the needs, we have different advantages, because this will allow time for an effective understanding of the need. It will create the right basis for the next step, that is the prior art analysis. It will also facilitate the proper market consultation, and also will avoid that these needs turn into very urgent needs. So having this preparation and having this periodically assessment of needs using different techniques. You can also look into our toolkit with examples of different techniques. One of these techniques is, for example, the functional analysis system techniques, to understand which are the functions that related to our needs. And based on these functions, we can develop keywords for the next step. And the next step is the prior art analysis and IPR search. So when do we do this? We do it once the needs are already identified. And this is basically a desktop research. So we look into all the information that is currently available in the public domain, scientific publications, reports, existing products, whether they are IPR protected or not. And then we look into different databases, international databases of the registered intellectual property rights to see what are the solutions out there. So there are different possibilities. We could have solutions available to the identified need, or perhaps these solutions will become available before the start of the procurement. We can also find out that there's no need for innovation procurement because we can already procure the solution off the shelf. But if there is some novelty identified, if there is something that needs to be developed, then we will see that perhaps the strategy is, for example, a PCP for research and development. The results of the prior art analysis and the IPR search will guarantee that the technological solutions to be developed are innovative and can thus be protected by IPR. Or alternative, it will reveal if there are already IPRs owned, and it will let us know which are these owners of IPR. So why it is very important to perform this prior art analysis and state-of-the-art analysis? Because it helps us identify the technology readiness levels and then the procurement method that we will choose. So what are the technology readiness levels? These are levels that were originally designed by the NASA, and these provide us the different moments of development of maturity of the solution, starting from TRL level 1 at the basic principles observed, and TRL 9, where the actual system is already proven in operational development. When we perform the prior art analysis, we will see that if we find a lot of patents and standards, we see that the technology readiness levels are higher, and perhaps we are closer to the commercial solution in order to perform a public procurement of innovative solutions and not a pre-commercial procurement. When we see that the technology readiness levels are lower at TRL 3 to TRL 7 or 8, pre-commercial procurement could be the method or the procurement approach to follow. If, for example, we find that there are only publications at very lower TRL levels, we could see also that there is a need for further development of the solutions. So by performing this prior art analysis, we could see and determine the technological readiness level of possible solutions that are based on the definition of our needs, working with keywords and certain performance also keywords that allows us to make searches. And how do we do these searches? We normally use intelligent tools, for example, the IPLITIC tools. This is a platform that provides us with different databases on patents, on scientific articles, on information about startups, about standard essential patents. And it's a tool that provides us also with the possibility to do a market landscape, to see who are the owners of these patents. This tool is a machine learning based tool and is scientifically validated by valuation indicators by important academic cooperation partners, that as we see the TU Berlin, the Mainz Paris Tech, and the Northwest University. So now let's go to step 3, the analysis of the standards landscape and why standards are important. Standards are important because they enable interoperability and compatibility between the old and the novel products. This is very important for us, for consumers, because it helps us also to reach products in the market that can be compatible. And by using standards, it's possible to include minimum quality safety requirements that are set up in the legislation, and it could be approved for the procurer of what the procurer is requesting, it is actually provided, increasing the confidence in the quality safety of the performance of certain solutions. It also reduces the costs and encourages innovation because, as I say, the consumers benefit from this greater competition, avoiding the lock-in and having lower costs of the product. Standards also allow providers to focus on their resources on producing products to clear specifications. Also for SMEs, standards are important because it helps them understand the requirements, and also in procurement, for example, the standard, the European standard document for procurement is also a way in which the companies can fill in information that is required for the procurement in a standardized way. So just to give an example. So once we have done the analysis of the standards to see if the standards that can help us define certain requirements for the procurement, we go to the step 4, the open market consultation. So why do we have an open market consultation? Why is it important to engage with the market? Of course, the procurers need to communicate what the needs are, what the challenges are, in order to also see what are the capabilities of the market. So there's a cross-check of the prior art analysis that we have performed and the IPR search of the standards landscape that we have identified. And we can also share with the market what the key contractual setup and the conditions of the procurement will be in order to verify whether the project is feasible or not, and understand the capabilities of the market in terms of the time, in terms of the maturity of the solutions. So this will clarify for us whether the desired solution is already available in the market and whether it can be purchased or developed in a way that is timely and cost efficient. So the procurer also is informed by this of the risk and benefits of the several technological solutions that are available in the market. And together with the analysis of the prior art and the open market consultation, you can provide the legal justification to choose between a PCP, a PPI, or an off-the-shelf procurement. So this is coming into justifying which is the trajectory to take. So the step number 5 is the business case. So here we go to the value calculation. So the business case is a tool that supports investment decisions before, during, and after the project. So before the project, at this stage of the preparation of the procurement, it will help us determine whether there are enough economic reasons to start the project. It helps us to see the cost and benefit analysis of the project, and help us also understand what are the aspects that consist of the value for the specific project. So in terms of function and cost. During the project, the business case will help us decide whether or not to proceed with the changes of the project content on the phases. And after the project, it helps us evaluate whether the goals have been accomplished or if there's a need for adjustments accordingly. So these are the 5 steps. And when we have performed these 5 steps in the preparation for the procurement, then we can go to define the procurement strategy based on the technology readiness level. So if we find that, again, looking at the chart, if we find that the technological readiness level has not reached 8 or 9, you will see that we have a PCP. We will see that at the last phase of the PCP, we can do the prototype testing. If the technological readiness levels are higher, then we will have a PPI, and then we will choose which kind of award procedure we need. And here I've had the example of perhaps a competitive dialogue, a competitive procedure with negotiation. So these are all procedures that fall under the directives, unlike the PCP, which is the PCP does not fall under the directives, but it must be compliant with all the principles of the Treaty on the Functioning of the European Union that are, of course, transparency, equal treatment, non-discrimination, proportionality, competition. But in the PPI, under the directives, we can choose a different award procedure. We can choose, for example, this competitive dialogue, competitive procedure with negotiation, or it could also be based on the results of the preparatory phase, that we choose an open procedure with framework agreements and with multiple suppliers, or a award procedure like the innovation partnership that combines the research and the deployment, but then there are some conditions in order to use that sort of procedure, and these need to be justified. So here we see the full-blown EAFIP methodology step by step. We have explained in a little bit more detail until step 5. So going from the research of the needs assessment and prioritization, then the state-of-the-art analysis, the open market consultations, and the business case that give us the cost and benefits analysis and the different scenarios. So in step number 6, we choose the procurement strategy. So based on the results of all these steps, we can determine the technology readiness level of the desired solution, the intellectual property rights strategy, and the choice of procedure, whether it's innovation partnership, pre-commercial procurement, public procurement with innovative solutions in the different award procedures. So this is going to be translated then into the tender documents and the procurement procedure steps for the award of a public contract. That is step 7. And step 8 consists in the contract management. The contract management is carried out based on how well we have defined the procurement strategy, translated into the procurement documents that establish the milestones that need to be monitored, the type of deliverables, and also performance clauses like value engineering. Value engineering that allows to make proposals along the term of the contract in order to present alternatives that both save the cost and improve the quality of the solutions. Step 9 of the methodology is the post-contract management. And here we have activities like standardization, for example, the link with the venture capital investors, and monitoring IPR obligations. For example, we have established royalty schemes in the contract, and they need to be monitored for the exploitation of the results and intellectual property rights. So we need to still monitor and manage these post-contract activities. And as in every public procurement cycle of improvement, the plan do act and check. That is, do we have the evaluations and the lessons learned? So we evaluate the lessons learned in order to apply our best practices in the next procurement. So here you see the EAFIP methodology step by step, and remember the importance of the preparatory, these 5 steps that will define the procurement strategy. So I'm almost about to finish the presentation. For you, I have some 4 main takeaways. And the first one is we need to use strategically the public procurement in order to steer innovation based on the needs and also looking into the future. So it is important to already embed in the organization these a system of needs analysis and looking for the future and possible challenge that you could tackle with a proper preparation for an innovation procurement in the future. Innovation procurement is strengthening also the relationship with the market, because we need to communicate and engage with the market to see what the market is capable of, and let the market prepare also in time to provide innovative solutions and use these instruments also to make the market participate and provide feedback already at the market consultation, even on the setup of the contractual conditions. Apply the step-by-step methodology, as in every complex program or project. We need to cut it in pieces also to reduce or mitigate the risks and know when to stop. You can stop in a step-by-step, and also use specific techniques to address each of the steps in this methodology for public procurement of innovation procurement. And remember again that the preparation phase is crucial to determine the procurement strategy and the choice of procedure. So here I thank you very much for your attention, and I'm here for you if you have any questions.
Thank you very much, Ana Lucia. Well, I think the methodology is very well explained and very clear. Thank you very much for your presentation. It's important, all the aspects as you mentioned about the identification of the need, and then to choose the best way through the innovation procurement process, to choose if it's a PCP, if it's a PPI, and innovation partnership, and so on. And I would like to ask you a little more about the execution of that project, of a PPI project. So, well, based on your experience about the execution, do you think that there are some barriers that we have to overcome? I don't know, it can be time needed then to execute the procurement, or if you found. Mm-hmm.
Which barriers? Yeah. I think perhaps not a barrier itself, but indeed the preparation should give you enough time, and for the definition also of the needs. And I would think it is very important the functional to have functional requirements defined. So give you some flexibility also. For the proposals that are going to be received. And I would say also it could become a barrier if you don't foresee in a PPI that is going to last, for example, for a long term, certain performance clauses like value engineering, because this allows you also to implement adaptations and innovations along the term of the contract. So I would say in order to overcome that, this barrier that perhaps you're locked into something, and during the project you realize that things can be done in a better way, and you also incentive the technology suppliers to look for new solutions. So that could be also a barrier if you get stagnated and don't have possibilities to overcome them and continue to innovate also in the long term in the term of a contractual relationship.
Mm-hmm. I will give the floor to Anna. Well, I will invite also Rosanna for the question part, to answer the questions that we received through Slido.
Thank you, Jose. Thank you, Anna and Rosanna. It was really interesting topic. And following the line of Jose, I have a question for Ana Lucia. As for the AFIP methodology, that's the key point of this stepwise approach is to harmonize the preparatory work for public procurement tool to afford time and prevent risks?
Yes, indeed. As I mentioned, this step by step, and also I think Rosanna mentioned it. I was saying Alexandra, but it's Rosanna. I'm very sorry. But this helps mitigate the risk, and indeed it helps you evaluate at the different steps the accomplishments that you have done, and whether it's a go or no go situation.
Is it publicly available, this tiered approach in covers or EAFIP webpage?
Yes, if you go to EAFIP, this is www.eafip.eu. You can download for free the toolkit, and the toolkit provides this step-by-step guidance, also with examples of actual cases and how they have used the different techniques. For example, for the needs analysis, the FAST technique, and also the with-bit technique that I think Rosanna had it also in the slides.
Thank you so much, Anna. And for Rosanna, Aquas has many experience in public procurement. As experts in this field, what are the most relevant benefits of public procurement tools?
Well, I think that somehow I tried to
yeah, of course,
to promote all these benefits with the first presentations. Really, for us, we are a stronger supporter of these instruments, because for us it has been somehow a way to instead of somehow to change our way of thinking while we are delivering healthcare services. And every time that now we want to make improvement in our healthcare service delivery, we start to think what is not working, if what is not working can be just changed with a new process. We have several initiatives. I don't know if you know that in Catalonia we have the observatory of how we do with the healthcare service. We have a project called Essential that is somehow promoting to not doing what is not bringing value to our healthcare service. We have the observatory of the innovation in management process of the healthcare services. All of this give us inputs continuously of our bottlenecks, and these bottlenecks needs sometimes to be smarter, in the way that then we procure next time, because maybe the reality is that what we are procuring normally is not really meeting our needs, or our relationship with the vendor is not bringing the value that we need. So it's a transformative somehow way of doing, but again, with a strategic view. It's not just it's not innovation per se, because this does not bring any value. We need to make sure that really this is an opportunity to look at what we are doing, is an opportunity to bring value to our citizens at the end.
Thank you, Rosanna. And so, Anna, I think you agree with Rosanna in this case, because
yes, absolutely. What she says, that is not innovation per se, but how to improve the services, how to improve, what the beneficiaries of these services receive. So, and also look into the future, not to the actual needs, but what could be the needs for the future.
So we will take these lessons to home, and the floor is yours, Jose. Thank you so much.
Thank you, Anna. Thank you for the speakers. Well, now we will move to the last part of the conference, that will be the Galician experience in public procurement of innovation projects. We will start first with the view of the ICT part. That we have the pleasure to have Javier Quiles del Rio, that he is IT manager at the Galician Health Service in the health area of Ferrol. He has more than 15 years as project manager leading the deployment and development of IT solutions at regional level, also involved in new networks and initiatives around e-health related topics on behalf of SERGAS, the Galician Health Service. He will present his experience on ICT projects based on public procurement and innovation. Thank you, Javier. The floor is yours. I think we can see your PowerPoint, but I think you have to. But we cannot hear you. I think you have to unmute.
Yes, now it's okay.
Yes.
Okay, thank you.
And full screen, please.
Yes, I'm trying to share the presentation with
perfect.
With this format. Now you can see it properly?
Yes, yeah. And the presentation as well.
Great, thank you. So thank you, Jose Maria, and thank you to the organizers of this workshop, and it's been quite interesting at the moment for me. So yeah, we'll start with one of the slides that I borrowed from you, Jose, and I really enjoyed this one from your presentation, and just want to focus on the experience of public procurement of innovation when applied to ICT projects. So I will narrow a little bit the focus of the discussion into this, let's say, somehow specific type of projects, because PCP and PPI can be applied to many different types of projects. But I think on ICT they have some features that deserve some specifications. So yes, well, in our experience in Galicia, on ICT and PPI used for ICT projects is based on a previous project that was going on for almost for 15 years now, of deployment of an electronic health record system all along the regional healthcare service areas. So on that basis, we have a number of tools and a number of skills that have been developed to promote ICT projects. So when we combine ICT projects with PPI, I think the mixture brings a lot of great results. So our first experience was, a well-known project. I think it's Hospital 2050 in Nova Saúde. We started doing this project in 2011. We had no experience previously on public procurement of innovation. So we really we were very lucky to obtain European regional funds to put funding on this kind of initiative. And from that opportunity, we brought up two large projects that allowed the Galician Healthcare Service to launch a number of 33 public procurement of innovation tenders. So, but if you make a little zoom into these projects, we can see that a large number, a large percentage of these projects were oriented to ICT solutions. So you see there the list, and you can see that more or less 60, 65, we could say even 70% of the projects were ICT oriented. So here we see that PPI and ICT combine well when going together. So, the rationale of the projects were all based in the same scheme, in the same step by step. I would say also the same that Tana and Rosanna before, step-by-step process. So we followed up. We have to say that the Galician Healthcare Service has already a number of needs that were identified. We had in the ICT unit a number of unmet needs that require the development of new solutions. So these first stages of need detection, market analysis, state-of-the-art analysis had been done. We were very sure that we needed these solutions to go on. So these first parts were already in place. So we started doing a market consultation, and then we launched the tenders and ran the projects for 2-3 years until they reached the final goal. So there are here a number of results from this first experience. And we received a very good feedback, I would say, from companies when the market consultation was launched on that time. It was very difficult to explain to companies what we wanted to do on that moment, because all companies were used. There was a culture of public tenders, but traditional public tenders, nothing to do with PPI. So there were a lot of workshops and sessions to inform the companies that there was a different model in place, and it took some time to see the companies react and understand which was the proposal of this new kind of tenders. But we received a lot of feedback from the market, and also we received this feedback from the market was analyzed, and we saw that almost 85% of the proposals that were made by the companies in the response to the market consultation was giving a positive result, where they resulted interesting for the healthcare service to see which kind of solutions could be put in place in the PPI. So after that, we launched the tenders based on an open tender. Open public tender was the main modality, but a number of specific clauses for innovation were established on these tenders. So I just mentioned them very fast, very quickly, but I think they were somehow revolutionary on that moment because the IPR was given to the companies, so they were allowed to own the product, the final product, and also to take it to the market. And it was really a great break into the traditional model of the ownership was always on the client part, on the public service part. Then we also defined a number of steps into each tender, into each project, just to keep control of the progression and also to allow progressive funding of the companies that were making the developments. And then the Galician Healthcare Service got the compromise to become the first client and to open demonstrative scenarios to new clients for the companies, so to work together in the commercialization. And also, well, the benefits for the Galician Healthcare Service was to be allowed to use a new solution, license-free, to have the permission, if this was the decision of the public service, to perform the maintenance and the evolution of the solution in case that the company did not want to progress on the project. And also the companies offered a number of royalties according to their proposals and to the commercial results after the project. So, yeah, a number of companies participated, as I have already said. And we saw also that the companies that were awarded were including an SME on board. That was also a good news for us. And also, we saw that the objective also to promote internationalization of solutions and commercialization was also achievable because a number of companies, of multinational companies, were also interested and involved in the tenders and in the awarded contracts. So one of the examples of these PPI projects was to build a home monitoring solution that is called Telea. And after development on a PPI tender, we, as a public service, we launched also a tender to deploy these solutions. I think it's quite important to emphasize that the final goal of the innovation is to get a large deployment of the solutions at the end of these development stages. So Telea was successful in results, in preliminary results. So the Galician Healthcare Service decided to put it on place and deploy into all primary care centers and hospitals. So at the end of 2019, Telea was available and was a solution that was in place for every professional, healthcare professional, every patient in Galicia. So that was quite good news for this project. Also, another example was the platform for patients, the patient portal Saúde, where patients could access their own data. We have the electronic health record system in place, but it was closed to professional access. But with this innovation project, we could open it to the citizens. And well, it was also a solution that finally was deployed Nowadays, it's in place with more than 150,000 users and allows us to provide information to all the citizens of Galicia. It's been quite important nowadays with COVID situation. A third project that I wanted to mention was the secondary use of electronic healthcare records for analyzing this information, for research and for search of diseases. We are having now a data lake with all the information that was stored in the electronic health record system for making information analysis, natural process language analysis, and it's also one of the great results of these PPI tenders. Of course, time went by, and I think it was 2015. Jose knows more about the right dates, but I think more or less it was 2015, 2016. A new program for PPI was launched, and it was called Código 100, with 3 main lines for patient empowerment therapies and professional solutions. And we kept more or less the same model of doing PPI. We launched a market consultation in a number of detected needs. The answer was very good. I think that the companies were mature at that moment and they knew much more about PPI. So they had a great response to the market consultation. We received 210 ideas. And we went on with the public procurement of innovation to launch a number of ICT projects that you can see there. So some aspects were improved in this second big program for PPI in Galician Healthcare Service. And I think we learned that the open tender could be improved, and the new regulation for public procurement that was in place, launched by the European Commission, also brought new tools for public procurement of innovation, like such as Association for Innovation, and also, the competitive dialogue was already in place, but there was a new modality that was negotiation for innovation that was in place in the new model for public procurement, and we used that model. It was not really competitive dialogue, but it was negotiation for innovation, what we use here for ICT solutions. So this allows us to talk to the bidders before awarding the tenders, awarding the contracts. So we could listen to their proposals, we could see which were their main strength points, and we could provide some feedback after a meeting with each of the bidders. And of course, there was a report for all of them that was accessible to all of them. All the information was the same for all companies, but we could interact with the companies before awarding the contract. And I think it was a very, very positive modification in the procedures. And again, we did the same clauses regarding IPR and also benefits for the Galician Healthcare Service. Well, as a result for this second big program on PPI in Galicia, I just wanted to show 2 examples. That is, one app that was developed by an SME, a small company that was awarded with this project to build an app for diabetes patients. And now it's working, it's in place. They are planning to make a comparison and also a clinical evaluation of the results of this tool in one of our hospitals in Galicia. But the tool is in place and has been tested just a small test with 2 or 3 patients and to get some feedback, but they are ready to launch it to bigger populations and make a second step of validation. And we have here an example of artificial intelligence for image analysis. And it was applied, the system was called CADIA, for computer-aided diagnosis with artificial intelligence. And we also had very, very good results. This contract was awarded to a company that has a lot of linkages with research groups. So there was a collaboration between a company and research groups that put artificial intelligence algorithms in place into this platform that now is belonging to a company. It's called Beacon Tech. And also this technology was applied to pathology images, also with positive results. The last example I wanted to mention is called Share. It's a large platform that is oriented to provide to be a container of all kind of contents, all kind of information formats to provide the patients all kind of clinical information. So it's really a large project. It was more than 1 million euros funding for this project. And now on this platform, we can consolidate all kind of multimedia content that is clinically oriented for patients. And it has a great feature, I would say, because this platform is capable of making an analysis of the patient profile. It can detect which are the main areas where a patient could be interested in getting information and can be proactively provide advice or suggest a number of contents that can be that can be of interest of a particular patient. So we are somehow making some personalized content for each patient in the Galician healthcare service. So just my conclusions to wrap up is, of course, we got, I would say, successful projects on PPI on these years. And I think that is due to regional EU alignment in e-health main lines. It's also quite important to have an ICT e-health governance at the regional level, at the organizational level. Of course, the usage of the tools of public procurement of innovation, and also be able to combine funding for innovation with funding for deployment. I think it's also a key for reaching final results. And I think that was all on my side. Thank you.
Thank you very much, Javier. Well, before going to the questions, I would like to introduce Alicia Piñeiro, that she is the director of the consultancy service in Galaria. Galaria is created as an autonomous public society attached to the Galician Health Service Sergas. They provide high-tech healthcare service, develop, execute, and operate healthcare infrastructures promoted by the government of Galicia and promote consulting activities in the healthcare field. Well, I don't know if we can see Alicia. Yes, now we can. Yes.
Okay.
I don't know if we can hear you.
Yes.
Yes, now we can. Well, so Galicia will explain the Galician experience in the public procurement of innovation projects based in therapies. Thank you, Alicia, for joining us today, and the floor is yours.
Okay. I will try to share my screen.
Yes, we can see the... Yes, and now full screen. Yeah. Thank you very much. Sorry, Alicia, we cannot hear you. Before we could, but now I don't know. Yes, now I think we can.
Now?
Now perfect.
I will hear you worse, but I will try it in that way. Yes, I said thank you for your kind presentation, and thank you for the opportunity of being here today, sharing the Galician experience in new and advanced therapies, PCP and PPI-based projects. First, I would like to make a brief overview of the PCP experience in the Galician procurement of innovation journey. At the very beginning, in the Hospital 2050 and Innova Saúde project Javier has explained it before, we launched this Innovasuma PCP for the development of new biotechnological products for personalized medicine. And then we had the Empathics project, we tried to find new ICT solutions for patient empowerment. Then we have the Código 100 project, which I am going to explain today. And finally, we have both Innova Trial and Innova Microlab projects, which market presentation was presented last Friday. So, Código 100 is a public procurement innovation plan that has been explained by Jose and Javier earlier. And here we have the therapies action line, where we were looking to improve the quality of life of patients and contribute to the sustainability of the health system through developments in the biotechnology and biomedical fields in order to accelerate the implementation of personalized medicine in the Galician health system. In this Código 100 line, we launched 4 calls for tender. One of them was the CADIA project, which Javier has explained before. And we launched also 1 PCP and 2 innovation partnerships that I will present now. Let's go with the pre-commercial procurement experiences. And we launched only 1 PCP call, but with three challenges, one lot for each challenge. And both of them were aimed to the development and testing of new devices or tests based in biomarkers for early diagnosis, prediction of responses, or monitoring of patients with neurological or rheumatological disorders, and also for hematological or solid tumors. And that's why we divided the PCP call in 3 lots in a pathology basis, and 1 lot asked for biomarker-based solutions for the studies of neurological diseases, the other one for the study of rheumatic diseases, and lastly, biomarker-based solutions for liquid biopsy in cancer. Talking about the PCP design, and because the development of biotech and pharma solutions is very complex because of regulatory constraints and the need of samplings, recruiting patients or biobanking samples, they need too much time, and we decided to go on with only 2 phases. One for the definition, prototyping, and technical validation, the validation of the solution in an analytical and a benchtop setting, and another one for the proof of concept in a clinical setting with real patients or biobanking samples. And we did this in order to give more time to the companies to do their research. Regarding the tendering stage, we mobilized 10 companies, but 50% of them were excluded and 30% because of administrative issues. And here are the first lessons learned and that we have to take into account, and that's that SMEs and startups don't have strong legal departments, so a dedicated set of measures to help the companies with all the administrative documents and processes they have to go through could make a difference for a good PCP project. Finally, we had 5 participating companies, and 4 of them entered the phase 1 for the total fully development of their solutions. And I'm coming to the description of the final PCP solutions. I'm going to, that's the way. For the first solution, the company BioCross presented a quantitative test of apolipoprotein E4 detection in human plasma. This quantitative test was designed to be used in clinical routine turbidimetry analyzers because previously there was very, very difficult to detect this protein. And also this protein is a major risk factor for non-dominantly inherited Alzheimer's disease, and therefore the company expected that the test could contribute to the prediction of Alzheimer's disease progression. The design of the test was successful, was developed and validated, but the scientific hypothesis was not demonstrated in the Código 100 project. That's why the company is planning to test the validity of this biomarker in the context of cardiological diseases, where it has also previous scientific background. And currently they offer this analysis as a service for research. And in the coming months, they are planning to sell the test, but on a research and development only design. The solution number 2 is the Pharma-HIC-Return test presented by Health in Code. And it is an NGS panel for genetic biomarkers related to the response to biological drugs and other treatments. It evaluates a set of genomic biomarkers previously described in the medical literature and associated with the response to disease-modifying anti-rheumatic biological drugs. And also with coding regions of the therapeutic targets of these drugs and pharmacogenetic biomarkers for treatments for comorbidities. This test was also successfully developed and validated, but in LDT design, and now the company is moving the solution to the IVD device format for CE marking, and also they are designing complementary validation and clinical utility studies looking for different populations, wider populations, and prospective studies. The solution number 3 for the PCP was the PQ reader and premonitor test. That was an integrated point-of-care solution for rheumatology for the quantitative monitoring of biological drugs and qualitative monitoring of anti-drug antibodies in human whole blood. In the scenario of Código 100, this compact and easy-to-use reader was tested with infliximab and anti-infliximab antibodies in a layer chromatography test. and it was successfully developed and validated also against the gold standard in the clinical setting. And the company now is developing a new pipeline of LC tests for other compounds that will be integrated in the solution. They have marketed this solution into the MND directive, and they are moving the CE marking to the MDR new directive. Solution number 4 for the PCP model is the OMTX100, which is a non-invasive diagnostic test that detects solid tumors in MRI-isolated blood from exosomes. And it is a multiplex analysis of a novel combination of genes expressed in tumor epithelial cells and also in tumor environment cells, and has rendered 83.5% sensitivity and full specificity in the detection of solid tumors in blood exosomes. The company has ongoing plans to show the feasibility of the solution in screening plans for colon cancer and early diagnosis of lung cancer. Then I will move to the innovation partnership procurement experience. And I want to explain why to decided to choose in this time this kind of procurement scheme. It has been explained before by Alessandra, the difference between PCP and IPP procurement. And the cases that we detected here are two unmet needs for research and development, with a very, very clearly defined target and very clear performance outputs, which we thought that if were reached by the proposed solutions and in a short frame time, could we purchase it and introduce it in our clinical processes. That was not the case for the already presented PCP challenges, which were not directed to a specific product, but a category or a family of products that could be of some help to increase the personalized medicine implementation in the Galician health service. Okay. We launched two IPP calls in this case. One for the development and validation of a multi-marker test to allow molecular characterization of tumors from patients with non-microcytic lung cancer for next generation sequencing. And the other one for the development and clinical testing of a multi-channel device for advanced resection of rectal tumors using a flexible endoscopy and transanal endoscopic surgery. The IPP design is quite similar to that of a PCP, but a little more complex because you need a previous selection phase where you have to be sure that you select the most suitable partners. And in our PCP, in our IPP design, we did this on the basis of the previous experience in the development and successful commercialization of medical devices or in vitro diagnostic devices marked with a CE mark. And we requested evidences of the regulatory authorizations. The competition scheme is also similar. We choose two phases of competition, but we decided to run in parallel the design and proof of concept and validation of the solutions, and the design of the conformity assessment plan, and also the development of the MDR or IVD technical file in order to achieve the CE mark before entering in the purchasing of the solution. Of course, as it is marked by the regulation, the purchase only takes place if performance levels and costs accord to that defined in the tender, but also if the final product achieves the CE mark. For the IPP tender number one, the IPP tender number one, we asked for the development and validation of a multi-marker test to allow molecular characterization of tumors from patients with non-microcytic lung cancer through next-generation sequencing. And it was a quite complex process in the selection stage. We received 6 proposals, only 4 of them were accepted to the negotiation phase, and finally only 2 presented a proposal to enter into the tender. The final solution, InPool 24NS-CLC, was developed by Agilent Technologies, and here we proposed an initial panel which had to be redesigned by co-development into a final panel and a bioinformatics pipeline to the analysis of the results. Both the analytical and the clinical validation was carried out within the schedule of the project, and good results and performance levels were achieved. But regarding to this CE IVD mark of the solution, and because of the changes coming from the new IVD regulation, Agilent went into a depth study by their legal and compliance departments, and it has not been possible to get this validation until further evaluation of the regulations. The second solution from the Innovation Partnership Procurement experience, we have a previous knowledge here. We have a pre-prototype, an idea developed by the Sergas surgeons, and they thought that it would be great if the removal of rectal lesions seen during an endoscopy could be removed without the need of a surgery in a later stage. This could lower the risk for the patients. This would also lower the recovery times, and also it will reduce the cost for the health service. And so they designed a very initial prototype of a minimally invasive technology that did not exist in the market. It was a multi-purpose anti-leak device for surgery that allows the entry of rigid, which is laparoscopic instrumentation, so that of the surgery scenario, and flexible instrumentation, that is endoscopes, into a single incision surgery. This device also allows to incorporate a pneumatic system to control the functionality at different times of surgery. We had the idea, but we needed a partner to further design, to investigate some troubles to make this kind of design, and also, of course, to industrialize and commercialize this device. We decided to use an innovation partnership procurement to find that partner as a way to ensure equal treatment and transparency to the interested economic operators. In this case, and because of IPR issues, only one proposal could be awarded to enter in the development phases. And patent licensing, because we already had patented this idea. Patent licensing to the selected partner was included as a clause in the tender, just in case the required performance levels were reached by the final solution. We think that it was a very innovative use of the Innovation Partnership Procurement Instrument, and that could be a model for future procedures. This IPP solution is named Unibec, was developed by Beck Medical, a little an SME from Spain. And in phase 1, they developed this kind of device. This is how it looked in phase 1. For mechanical validation in bench proofs and simulations and animal testing. And all the expected functionalities and performance levels were reached at this phase. But a very critical step was the design of the pneumatic seal, where they needed to make a little research. And final, in phase 2, they moved to this final design. This is how the solution looks like for the clinical testing and marketing commercialization. There are ongoing multi-site clinical investigation now at 6 hospitals, and the MDR technical file has been developed. This experience has been final nominee to the 2020 Procura Plus Awards. And I think that this was all by my side, and thank you very much for your attention.
Thank you very much, Alicia. Well, I would like also to ask Javier to be now for the last part. Well, it's just a comment and a question. It's about, well, you both present a lot of results thanks to all these projects that we had here in the Galician Health Service, from Código 100, Innova Saúde, Hospital 2050, and now also we are running 2 new projects based on public procurement of innovation. And I'm asking about the impact, and also it's a general question about how you see the Galician Health Service in the near future. You think that we must continue applying for this type of projects based on the results that we now achieve? I don't know who wants to start first, Alicia, Javier?
Yes, well, maybe may I?
Yes, sure.
Okay, so, well, I think we are now prepared to move on, but I'm afraid that for our healthcare service this last year was a bit difficult to promote innovation during the pandemic situation. We could see that a number of projects had to stay a little bit back because, of course, the main activity of healthcare services providing healthcare, and there were, well, a number of situations along this year that, sorry, a lot of noise here today, but of course we are looking for future, and we are on ICT part we have a number of projects that are waiting for funding. We are waiting for next generation funding that is expected to come in a few weeks, months. So a number of new ICT systems will be in place. We are doing now this state-of-the-art analysis for new solutions in the areas of pathology for diagnosis. We are looking also for solutions in the area of the operating theaters, also to put in place some traceability systems, and also for, also maybe because of the pandemic situation in the intensive care units, we are also looking for new solutions for intensive care. And also, public health, I think, is an area that, of course, this situation has arisen, a number of improvements that can be done. So I think it's also an area that will be active on public procurement of innovation in the next months. Yeah.
Mm-hmm. Well, and can you hear me?
Yes, sure.
Regarding to the biotech and the pharma projects, we have gained a lot of experience, and it could be a pity if we stop here. And also we have the personalized medicine strategy, which we are working for, and we think that many experience will come from that strategy. But as Javier said, with this pandemic, the situation in the health system is very, very difficult. I have to say that experiences that I have presented were developed in 2019, but also in 2020. And companies had to face a very, very, very complex situation. First with the lockdown, where they couldn't work. But then after the lockdown, they started to work, but in a very, very poor situation, with a great difficulty to work with patients to obtain the access to the hospitals and to the samples. And also with supply problems, because the medical devices and the IVD devices market was broken, and they had even no glassware or plasticware tips for the experiments. So I think that it is a quite difficult moment to go on, but after this situation improves, I think that we will go on.
Thank you very much for both. I'm going to give the floor to Anna if there is any question in the Slido.
Thank you very much, Jose. Although I would like to ask one question for Alicia and Javier, I kindly ask Ana Lucia, Rosana, and Gianni to join us for the polling session. So, firstly, I would like to ask you, Alicia and Javier, there were many outcomes, Sergas has been achieved many outcomes, but which were the main barriers that Sergas has addressed during the application of PPI and PCP tools? So, who wants to answer? Alicia or Javier?
Maybe you first now, Alicia, just to keep fair.
Well, I think that I already explained that a big problem with PCP experiences in the biotech sector is that if you work with SMEs or startups, they are not very used to the tendering. They do not have a strong legal department or even any legal department in the companies. So it's very hard to them to do the tender correctly. And if you work with very big companies, multinational companies, they are not very used to collaborate in this kind of innovation experiences. And then they have extremely strict legal departments, and it is difficult to explain them this kind of instruments and to go on with the solutions.
So the trick is working with SMEs and big companies. And
yes.
And what do you think, Javier?
Well, I was just reading the screen, some answers that have been provided. Well, in my opinion, there is the models for public procurement. Maybe they could be better fitted for ICT projects in some aspects. For me, for example, PCP model on 3 stages with a prototype design is a complex model for ICT solutions. It requires a lot of steps inside the procedure itself, and for an ICT solution, I think you can build up a prototype in a very, very fast time and can be included in a first stage of the solutions. So for me, PCP models could be improved in case of ICT projects. I think the 3-step is brings on an extra administrative step to check in a first, second step. And for ICT projects, you could do this in a more straight line. I could see last year a number of projects on PCP for ICT solutions, and all of them, the calendar was taken to 40 months for an ICT development. And well, I think it's not really fitted, because on ICT, things change from year to year. So you start working on a technology, and the next year you have a different, improved technology. So these periods should be shortened in order to be fitted for ICT solutions. And that's one of the things that could be done to ease and to improve the results and the effectiveness of ICT, of PPI. So, and also, well, I could see some answers there, and I agree that in the public system, there must be some kind of teams that should be dedicated more focusedly, more specifically to PPI, and to increase the skills of public servants on this area. I think it's also a good question, because you work on projects, but you have to keep the activities working for need detection, for process of innovation working on, and I think also increasing the skills for public servants on this area is desirable. Thank you.
Thank you so much. So let's move to the polling session. I think this is this question is pretty well known. So do you agree that regional institutions should be more involved in supporting new innovative procurement tools, PCP and PPI for personalized medicine? I think actually that most of institutions that had the opportunity to give this overview during this conference, they are involved, but always it's needed more. So what do you think that the majority of the audience just answered yes? So any comments of this question? Okay. I think most of you are agree with this question. Thank you.
I'm not really agree. I think they are really involved, but I think there is a structural problem, because the real challenge is to get funding for moving PPI properly. And I think you move PPI when you find a program for funding that comes from Europe or comes from specific funding. But maybe in the structure of the budget of the public institutions, there should be always a part to be dedicated to public procurement of innovation, because otherwise you put in risk your, let's say, ordinary budget, and you have to play with things that you don't know the result. So the managers that have to take the decision to put some budget into PPI are always compromised by results at the end. So maybe a structure of the budget, of the public budget, that dedicates 3% of the budget, 1% of the budget, whatever percentage of the budget for PPI could be a solution, because then the managers would be obliged to say, okay, I have to move this PPI until the end, and I'm not putting my decision in risk. I have to do it. So it's just an idea to put on the table.
Thank you. I think following in the line that you were talking, that you talked before, this is the next question. That is, which are the main barriers for implementing innovative procurement in your region? You said, Javier, maybe a specific team for working in PPI and PCP, and also another budgets specifically with on this topic, isn't it?
Yes, I think this kind of measures should bring results and keep a sustainable activities on PPI, because I think that the organizations are aware of the benefits, but they don't have the tools to put it in place in an ordinary way. We say you have to always search for additional funding and move on different programs from time to time when you have the opportunity to do that. But to consolidate PPI, I think there should be some structural measurements to put on board.
And the rest, what do you think? Rosanna and Anna, as experts?
Well, I somehow agree. There is clearly, there should be somehow a knowledge that also you are sharing now, but in fact we know also, at least from us, because we always exchange our knowledge between Catalonia and Galicia, that also you have somehow a structure already in the organization. That's key. So some competence, knowledge, lessons learned that are transmitting from project to project are key elements, because this is something like a core part aspect. And also I agree with the budget, but the budget I would add an element to what Javier said, that the element could be, it depends, so I agree, fully agree with Javier, just adding part, aspects, that it could be depending on, again, on the ambition. If the ambition is small, and let's start with small things, because the difficult part is start with big project, big ambition needs to be addressed. Maybe we could start with small things already in the running budget. And so the risk that we are taking, we already need to spend some money in buying something, we already do in a routinary way, and we already allocate a small part of this percentage of the budget introducing some pieces of innovation. And this is maybe something that really is, we don't need a new additional budget for doing this. And this is a very good exercise to start, I think. So with clearly elements of innovation, not clearly, it will not be a PCP at all, because we are taking a small risk on something that can be applied on routinary procurement, but that already had some smart working that needs to be done from a buyer perspective. And yes, another thing that it's I tried to somehow explain with my presentation, and also in any case Ana Lucia added with her presentation, the preparatory stage of the procurement is far more extensive than a normal routinary procurement that we are used to. So there is a change in the paradigm, because usually we don't do so deep work before doing a procurement. But this is not bad. This is good. It's just that we need to somehow shift the effort prior to the procurement, because then the monitoring will be somehow easier also, because we already know how to monitor everything. And so yes, it's some aspect in the team, in the core, and the team that needs is key, and also the budget clearly is key. But again, maybe starting with small things, it's easier. Thank you.
Yes, I would add that indeed it is important to have this mindset to prepare and to have less risk aversion, because it entails a bit of risk anytime we talk about innovation, and have a good balance between the scope of the project, the resources, and the time. And here I would like to add a comment on what Javier mentioned about the PCP approach. It would depend on the level of development that is needed. It's also for ICT solutions. We have experience with different projects, and especially with one in Smart Dublin, we found out that we could have an open procedure with a testing phase. So have a procedure that allowed both the testing and the deployment of the solution in a short time. So, but this is because we have already looked into the market and seen that there were solutions closer to the market that needed testing in a specific environment in order to be able to purchase from that, and perhaps to purchase from different suppliers. So this setup of open procedure with framework agreements allowed this possibility of flexibility and the possibility to test and purchase only from the successful solutions. So that to give additional options into the palette of tools that we have for public procurement, for innovation procurement.
So thank you so much. So just you answer the following question of what needs to be changed to facilitate the employment of innovative procurement tools. You just said that it's needed new teams, a specific team. You said budget, that is always necessary. So we will move to the next question, and is, what do you think, are PCP and PPI completely implemented in your region? What do you think, Javier, Ana Lucia, Rosana, or Gianni? Because
well, I'm sorry.
No, sorry, go on, Rosana.
I'm surprised that the audience says 71%, so we are very experienced regions we are answering. By the way, I don't think that really, in the experience of Europe, there is a percentage that the European Union has the ambition to have at least the 70% of public procurement of innovation, of overall the public procurement should be public procurement of innovation, and we are far behind this percentage across Europe. So I don't think that really any region can really, although we have regions where we have experience in this, still yet maybe in some sectors we are more active than others, or maybe, but still we have a learning curve too, no? to go through.
Thank you, Rosanna. And Anna?
Yeah, I think there are important experiences both in PCP and PPI, but of course there's always room to improvement. And the lessons learned from the previous project will help, again, the newcomers, let's say. So yeah, I'm impressed to see 71%. That's a good sign.
Positive people. So thank you so much. The floor is yours, Jose.
Thank you very much for all the speakers. And now for the closing remarks, I would like to give the floor to Gianni, the coordinator of the Regions for Permit project.
I'm also very surprised by the 71%. I think most people have answered from Galicia, because you did have a great experience. So, because in the other regions, Tuscan included, we don't have a very background on these tools, and I think in all the other regions in few other regions that we have in our network, there is such a capacity that Galicia has. So this also brings me to the conclusion of this second day. I have learned so much about these tools. I think PCP and PPIs really can be a tool, an instrument for regional authorities to promote research and innovation on personalized medicine. I think us as a consortium need to push this in our reports and in our guidelines, and also we should maybe together with the speakers of today and yesterday try to put in place some action in this regard. Also learning from the great experience that Galicia has told us today. So yeah, I mean, I think these are the main outcomes of these 2 days. I would like to thank once again Jose, Ana, Galicia Region, ASIS, and Sergas for this wonderfully organized meeting, and of course all the speakers for the knowledge that they have shared, the level of interactions they've been engaged to, and for the ideas that they have provided to this consortium. So thanks again to all of you.
Thank you very much, Gianni.
Thank you.
Well, just in practical terms, well, today finished the conference, that it was a 2 days conference. The conference will be recorded and it will be uploaded into the YouTube channel of ASIS, of the Galician Health Knowledge Agency, if you want to check it again. And just final words to say thank you to the organization, to my colleagues here in ASIS who could organize this organization, to Anna, that she works also in the innovation unit, and of course to all the speakers and also to the audience that was connected during these 2 days. Thank you very much and see you soon.
Thank you. Thank you very much.